This is the second part of these fish diseases. In this video, we are going to discuss parasitic, protozoan, and fungal diseases. The topics are: number 1, parasitic, protozoan, fungal, and their control strategies. Number 2 is fungal diseases, while number 3 is control strategy of disease in affected farm. And lastly, number 4, control measures of parasite and other diseases. Fish diseases can cause a serious loss of revenue to our aquaculturists, that is, fish farmers. The control of fish disease is mainly their prevention, and prevention is always better, cheaper, and simpler than cure or treatment. The general steps include observing general cultural and sanitary requirements in the course of rearing and maintaining fish pond. Every new batch of fish brought into the farm should go through quarantine. Let me just take you a little bit back to the first slide. What I really mean by sanitary requirement is that whenever a fish dies, you should immediately remove them from the pond, and there should be change of water partially or completely every 2 days. And when you have much water in your farm, it can be every day, but with little disturbance. Should allow the water to go in and go out without any disturbance, so as not to cause stress to the fish. The species of worms vary with each species of fish involved. Infected fish become receptive and are collected in large number at the inlet of water. The clinical signs of these parasitic diseases, especially tapeworms: the gills look pale, insufficient blood, anemia. Number 2, sometimes the body covered with mucus. There will be slime. Number 3, epithelial cells are normally destroyed. Susceptible species include common carp and all other fish species. Treatment: administer di-n-butyl tin oxide in fish feed. The required dose added to the feed is 0.25 milligram per kg per day for 5 consecutive days. Protozoan is a single-cell organism. They are usually found externally in the fish, but some occasionally infect internal organs and tissue. A characteristic of this organism is their ability to form a very resistant resting stage, which allows them to persist after treatment. And one of the protozoan diseases is white spot, and it is the most common in fish pond. Each is a common name of Etiopterus multiplis, which is a white spot disease. It's the more common occurring disease of freshwater fish and easily transfer from one fish to another one. The causatic agent is the infusion of Ethopteros multiplis of the family Opryolenidae in the class related. They are ovoid and horseshoe shape. Each is the largest non-parasitic protozoan found on fish. The breeding stage is in the form of cysts between the layers of the host skin of fish. When it is mature, it leaves the fish and produces large numbers of free swimming young ones that must find a host within 48 hours or they will die. The clinical signs include the presence of white spots on the skins and gills of the fish. Noticeable on the body and fin of the infected fish are salt-like specks and excessive slime. There will also be loss of appetite. Heavily infected fish usually congregate. They gather at the water intake and outlet of the pond. The fish develop thinning epithelium and excessive mucus. There will be appearance of swell on the skin, which will be noticed due to their Arctic attack, penetration of the epitheliums and the growth of the organism. Susceptible species are catfish and common crabs, and other fish might be carrier of each. Treatment of each white spot. If fish are maintained indoors in tanks, formalin can be used to treat each. The treatments are of two types. Number one, a short-term bath, and number two, a long-time bath. In a short-term bath, 250 milligram per liter for 30 to 60 minutes. That is, the fish should be placed in a container and allowed to remain for about 30 to 60 minutes and water flush. This can be followed by a change of water. A long-time bath of 15 milligram per liter of formalin treatment in the tank does not need to be flushed. The water you don't have to flush the water. Or 30 milligram per liter of quinine sulfate is also recommended for the treatment of this white spot disease. If the stocking rate is low or small, you can do the salt treatment. Salt treatment of each is not practicable in pond because even large salt of 0.01%, that is 100 milligram per liter, will require large quantity of salt. The fish can be dipped in a 3%, that is 30,000 milligram per liter solution of salt for 30 seconds to several minutes. But this has to be done with caution. Costaiasis, common name Costia. This is another protozoan parasitic disease that affects young and older fish. Costia are very small pear-shaped protozoan. Pear-shaped protozoan. They propel themselves using flagella. I remember this when we are in the class. Our tutor asked us to draw this, even though we are not in the biology class. It is pear-shaped protozoan. Clinical sign that will be present of blue-gray film appears over body surface. Blue-gray film. You cannot miss it. Fish do not feed. There will be damage to the fins, and you will notice quick, erratic movement of fish. The fry becomes emaciated. A fry can be a 2-3 days or larva. The gills will be pale and covered by mucus. Susceptible species to costia disease are goldfish and catfish. Treatments: add 3 parts per million of potassium permanganate, that is, dissolve 3 ml in 1 liter of water. It will give you 3 parts per million. Or dip the fish in bath of 5%, 5 over 100 times 1000, or to 10% of sodium chloride for at least 5 to 20 minutes daily for up to 1 week. Young fish should be separated from spawners. Fungal diseases. Fungi usually attack dead tissues, which is the reason they colonize dead eggs of fish. They also attack site of wound on a live fish body. In more serious infection, they look like tufts of dirty cotton wool. Once this stage has been reached, it is difficult to dislodge. General clinical sign of fungal disease: there will be several fuzzy appearances, usually associated with localized discolor areas or lesion. There will be loss of equilibrium and stagger movement. Saprolegniasis. Clinically affected fish develop white to brown cotton-like growths on skin, gills, and dead eggs of the fish. Diagnosis is by finding broad, non-separate branching hypa that produce motile flagellated zoospores in the terminal sporangia. Treatment: in a pond, quick lime, that is calcium oxide or copper sulfate, could be used to treat the fish, to treat the disease. Give fluconazole at 22.6 mg per gallon daily for 5 days. Gill rot, branchiomyces. Affected fish normally show respiratory distress, that is breathing hard. There will be gill necrosis. Treatment. The best treatment is with copper at 0.2 milligram per liter, that is 0.2 part per million, to be repeated once in a few days if necessary. Control strategies of diseases in affected farm. If communicable diseases is identified, then get the data in the amount of disease fish, number of the affected pond, the clinical picture of the disease and microbial result should be noted, and measures for the eradication should be mentioned. A decision should be made on the quarantine. All transport of fish in the affected farm should be reduced to minimum or stopped. New fishing gear, as well as all fishing gears in the farm, should be isolated. During this period, the pond should be disinfected. Treatment in quarantine. Number 1, there are 8 stages to be followed strictly. Number 1, place the new fish in quarantine system. Then systematic observation should be followed, and it is very necessary for any unusual behavior for at least 3 days or until they are feeding normally. Number 2, you have to starve all fish for 12 hours and then place no more than 6 in a separate bath. Aerate the water with air pump containing 200 parts per million of formalin solution. Number 3, leave the fish for 1 hour. The 6 fish should be left in the water for at least 1 hour until they appear stressed and gasp for air at the water surface. When you notice this, transfer them to another pond containing fresh water and leave them to recover for 24 hours. Repeat the treatment to all the fish on the following day. Treatment in quarantine continue. Number 5, allow the fish for 3 days to recover with feeding, adequate feeding, and again stop them for 12 hours. Number 6, take 6 fish. Why are you taking 6 fish? It's bioassay. You want to find out, you want to observe and see their behavior while they are in this chemical solution. Take 6 fish and place them in a separate aerated bath containing 2 parts per million zinc free malachite green solution. Allow them to stay for 1 hour until they appear stressed, and then transfer the fish to freshwater pond. This malachite green is very, very dangerous. You should be very careful with this chemical. Number 7, repeat malachite treatment. Malachite comes in powder and in liquid solution. Repeat malachite treatment for 3 consecutive days, but be sure that the fish appear to be well before repeating a treatment. Keep the fish in quarantine for a week, feeding them balanced diet, observing them for signs of ill health. In summary, control parasite and other diseases and their control. Please Do not transfer infected fish to water that is free of the parasite. Calcium cyanide has been suggested as excellent disinfectant. A dose of calcium cyanide of 1 kg per meter square can be administered. For tapeworm symptoms, adult fish entering point into the pond should be prevented. Give them metronidazole. As for tremators, there should be wire mesh and filters in the inlet of the water of the pond water. I should endeavor to remove snails in the farm. As for nematode, you should improve sanitary condition. To therapeutic measures, use satonite at 0.4 gram per fish. As for mollusks, 20 milligrams or 20 grams of copper carbonate to 1000 meters square of pond bottom. Or you can also use copper sulfate and should be given at least 1 part per million or less than 1 part per million. Control of fungolysis. You should avoid pollution. Avoidance of pollution with organic matter. Dead fish should be buried. And you can use antibiotic, sulfonamide. Bacterial enteritis. You should maintain good quality food. Antibiotic medicinal plant is recommended, such as garlic, onion, eucalyptus leaf. I must not forget to thank my mentor, Professor Solomon Lamburda Lamai, for his encouragement, support, and above all, for believing in me that I can do it, and now doing it for you as a gentle, humble gesture. Please be sure to subscribe so that you will be updated. Thank you so much. God bless.